Here's what doctors don't tell you about PCOS. PCOS stands for Polycystic Ovarian Syndrome. I don't like that name because it's implying there are cysts in the ovaries. They're not cysts, they're follicles. Follicles are little water balloons inside the ovaries, and each contains an egg. When you're born, you have a certain number of eggs. Each month, you're releasing one follicle, and during the time of ovulation, that egg that's inside that water balloon or follicle is going to explode. That's called ovulation. If a sperm meets the egg, you have fertilization, and then you have an embryo that gets implanted inside the uterus. There's a signal from your brain to your ovary to your uterus to have a period each month. When that coordination is thrown off, we have PCOS. You might have no bleeding or bleeding between periods. You might randomly have bleeding. You might go periods without a bleed, and that's PCOS. When patients present to the clinic, common symptoms include excessive hair growth, acne, and changes in their period, not having a period for a long time, skipping periods, or bleeding in between their periods. In some cases, patients may have heavy menses or periods, and it disturbs their quality of life in some way. How do we diagnose PCOS? We use the Rotterdam criteria, but also discussing with the patient what their chief complaint is important. For the Rotterdam criteria, we want to see symptoms of hyperandrogenism, which means there's high estrogen in the system. The second thing we do is blood work, looking for high testosterone levels and ruling out other causes of hyperandrogenism, meaning excessive hair growth and acne. As an OBGYN, my job is to prevent big, scary things. The first thing I look out for with PCOS is endometrial cancer. When you're having irregular bleeding and irregular menses, the lining of the uterus gets disorganized, and that disorganized lining can increase the risk for endometrial cancer. Increased risk of insulin resistance with PCOS. I'm going to get your hemoglobin A1C to see how you're processing sugar over the last 3 months. The next thing is quality of life. If you're having periods that are very heavy, that's going to affect your day-to-day and cause anemia. If the ovaries are releasing eggs at random times, it's hard to coordinate efforts. My goal is to help you have regular periods. One of the ways that we can do that is with hormone therapy, and I may want to start you on a birth control pill. Now we're going to talk about what everybody wants to know. How do we manage PCOS? The first thing is lifestyle modification. Second, we have to address is insulin resistance and how that risk increases with PCOS. The last thing I address with my patients is infertility. In PCOS patients, there may be increased infertility because it's not a coordinated menstrual cycle. That may make it difficult to get pregnant. I understand your quality of life may not be where you want it. I understand how frustrating it is to not have answers. That's why I'm creating these educational videos, because I want you to have answers that are evidence-based and backed by research. If you want more of this type of content, make sure to subscribe, and I'll see you in the next one.